Hey guys, I'm Jeff, the CEO of E2M Fitness. What I wanted to do today was have two of my postpartum teammates come in and basically tell you a little bit about themselves and just what we do for postpartum mamas out there. So first of all, ladies, I want to start with you. Ma'am, introduce yourselves to the crowd.
I'm Marissa. I'm one of the postpartum coaches. I am an occupational therapist. I am a certified pregnancy and postpartum exercise specialist, and I have a personal training certification. And my role in the group is I bring in some exercises for women that have diastasis recti or pelvic floor issues and certain modifications that they can do when they're postpartum to try and bridge that gap between having a baby and getting back into a regular workout routine that they had prior to pregnancy.
I love it. And ma'am?
I am Rebecca. I am one of the 4 mental fitness coaches for the regular group, but joining the postpartum group this time with adding a mental fitness component to it.
I love it.
So I'm a clinical psychologist by training, and I'm getting certified as a mental health specialist for postpartum and perinatal mental health.
I love it.
So what I can bring to the table for hopefully the group is a lot of different ways to approach the cognitive and mental components that kind of trip us up a little bit, especially with how much change comes through postpartum and pregnancy. And helping people really find a place where they can be comfortable in a new role, one of the most important roles of their life of parenting.
I love it. Well, as you guys know, I'm not the postpartum guy. I'm the moderator. So I'm happy to be here with these ladies today. So first of all, Marissa, a lot of women, when they go through that transition between having their child and being ready to get back into working out, what are those initial steps? How would somebody know if they're ready to come back and start working out? What's that initial trigger point to get them back?
It's really hard. It's really based on the person because a lot of women will have different experiences. So it depends on how athletic you were and how in shape you were prior to pregnancy. Depends on your pregnancy, whether you had 1 or 2 babies.
True.
Birth comes into effect. If you have a really traumatic birth experience, you have an emergency C-section, your recovery is going to be very different than a woman that had a vaginal birth that didn't have any issues. And so it's really personal based, but you also have to get cleared from your doctor, which is the first and foremost. C-sections are a longer recovery as well, but it's nice. You really have to listen to your body and base it off of that. And when you feel comfortable and ready, there's not a day where you wake up and all of a sudden you feel like you're ready to go all for it. You just kind of have to figure out when you're ready and start moving. Movement helps the healing process. Getting up and moving, you can't sit down all day and nurse that baby and not get up and stretch and move. So it just depends. And you really want to get up and start moving your body. It's okay to do that. And they just have to understand that it's not a selfish thing. It's important for movement. You want to get that blood flowing. And at the same time, you need to allow your body to heal properly. So that's why where we come in, we are bringing the knowledge of knowing how to help them rebuild from the inside out properly and not to cause further damage while they're in the healing process of postpartum life.
No, I love that. I would assume that most women, when they are cleared, when their doctor does clear them, especially ladies who've seen their bodies transform, picking up the weight of pregnancy and things like that, they want to go as hard as they can. What would you recommend to somebody who they want to see their body get back to the old pre-pregnancy body as fast as, because I can only imagine. It would be something that most ladies are excited. Like, I can train. Let me go after it. What would you advise?
So I've been there, done that, right? I come from experience with this role. I have 3 children of my own. I've been through 3 very different pregnancies. My first one, I did go gun-ho afterwards. The second one, I was unable to because I had DR myself and I had a lot of issues and I had to work through that. The thing women need to understand is when you're pregnant, you are going through so many physical changes as well as mental, like the curvature of your spine changes, your hips widen, you have a relaxin hormone going through your body that makes all of your joints become laxed. So you have all of this stuff going on for months after you have the baby, and they need to understand that you're at a high risk of getting hurt because 100% of women in the 3rd trimester of pregnancy have a diastasis recti, which is a separation of the connective tissue down your stomach. And some heal naturally and some don't. Some women need to have the extra help to get that to go back. So when these women are diving in, not to mention the tissue tears and everything else that has changed, all the physiological stuff, you have to really be careful to go back in slowly and carefully. It's almost like you don't want to build a house on a messed up foundation. So you have to really build a strong foundation. Fix that core, get everything, your pelvic floor, your core healed, and then rebuild back for optimal results.
I love it.
Yeah. If not, you can end up with a ton of issues, and then you're going backwards and getting therapy to work back to what you want to get instead of going forward from the beginning.
Well, I love it. Rebecca, Marissa just mentioned the mental component of, getting yourself back into health and wellness and trying to take care of your body. What do you recommend for most women as they're trying to handle that mental aspect of they're not pregnant anymore, but they're seeing a different body than they saw before, but now they can't attribute it to just being pregnant. It's post-pregnancy.
Right.
So what are some of those first steps of like understanding that, or what can women do to help with that?
Yeah, that's a great approach. So to your point, it's not the physical appearance anymore. Like Marissa, I have one on the way. So I'm kind of in the middle of the pregnancy postpartum journey again. But to her point, it's different every time. And after you give birth and you're hoping your body returns back to normal, we have this perception or this idea of I'm going to go back to my old self, or I want to get back to where I was. And I encourage birthing people to look at, I'm gonna look at it a different approach. Instead of saying I'm gonna go back to where I was, move forward in an approach of I'm gonna look for a new me. Because if we take it, and I even did this with myself internally after my first pregnancy. I'm doing it right now in my current pregnancy. I'm not running as fast as I did pre-pregnancy.
Right.
And you need to give yourself. Everybody says give yourself grace a little bit, but maybe take away that piece of reflecting so much on your old self and look at where you're currently at and move forward from a future perspective. There's a lot of mental components, cognitive components that can help with that. Mindfulness techniques, things like that we can really dive into to help with looking ahead.
I love that. And my goal, and the reason why I'm the moderator, I like to bring all the resources to all my clients. And so for my postpartum mamas, my thing is I want to bring them together to have a community. What is the importance of having community during that phase, or having support during that postpartum phase, Rebecca?
So interpersonal interaction, and I've spoken about this in a lot of my mental fitness lives. We're human beings, no matter how introverted or extroverted we are, we need human beings in our lives. And those of us I'm more introverted, so my level of needing that interpersonal support maybe looks different from somebody who's extroverted, but you still need it there. So this is why this program is so important, is because E2M can really support the interpersonal connectivity and finding people who are in similar situations, not the same, but a similar situation that brings them together in a safe place where you feel you can open up a little bit. One of the things I recommend for patients or clients I'm working with, regardless of what issues they're going through or concerns they're going through, is when you feel like you're pulling away from that interpersonal connectivity, that's when you need to dive in more. And that's when you need to focus on your APs, the people that are in your lives that know you best. They're going to see that withdrawal a little bit. They're going to see that pulling away. That's when you need to dive in a little bit and ask yourself, hey, if I'm pulling away a little bit, if I'm feeling like I'm isolating, that's when you need to dive in, because the accountability partner, the person, the connectivity, the human component is going to be able to bring you back in and help you see objectively your situation a lot different than maybe you're internally seeing it.
Man, I love that. And I'm one of those guys. I've learned a lot of hard things in business, and the psychological aspect to all this stuff is very important. And understanding how to meet the needs of my clients is extremely important. So before we go, guys, I just want to kind of talk about some of the experiences you've had working with postpartum women, not just with E2M, just in general, and just some of the things you've learned and some of the things that you can share as tips, just overall, because I want people to know that, of course, they heard you talk and you're extremely knowledgeable. But if you want to talk about some of the experiences you've already had, how many people you've trained, that kind of stuff, I try to bring to my clients the best people, the most knowledgeable people, the people that care the most, honestly, also care the most about what they're doing. And Marissa and Rebecca definitely care most. So before we go, any stories you want to share, any accolades you want to share so they know your passion and your story for wanting to help women?
Yeah, I mean, so I actually came on to E2M after having my third baby. And so I actually healed myself while teaching these women in the group. And the group had grown substantially in a year from about 4,500 people to 27,000 women. And I've had more people come to me and say that I changed their lives. And one of the things that I found amazing was the doctors that were coming to me and the pelvic floor therapists that were saying, the doctors were like, we weren't taught this in school. We didn't know this for women. Most of the women that I was working with weren't even necessarily postpartum. A lot of these women, you're not told these things about your body after you have a baby, and you're kind of thrown to the wolves. And society really just doesn't back us up enough with the postpartum world. And so we're offering something really special here that women don't know about, that they don't have to live with these issues that they have after they have babies. And that's one of the biggest things that people have come to me. Like, I had my babies 30 years ago. I wish you were here before. I wish you told me these things before. I lived with pain and embarrassing parts that they had to live with, like urinary incontinence and all this stuff that they didn't know that they could fix with just these exercises and breathing and stuff like that. So for me, I find it extremely fulfilling. I just want to shout it from the rooftops and help as many women as I can, because I just am so passionate about, it's such a hard time. You're never more vulnerable in your life than after you have a baby. I feel like, I mean, you lose yourself. Like, you give everything you have to this child. Your body is different. Your mind is different. You're just in a weird period. And so it's a really special place to have a bunch of women that are going through the same thing or have gone through it and understand and can bring that level of experience, but still have some issues that they're working on. And we can really help with the knowledge that we have to help them come through this. And these are specifically like a lot of things that women go through. And so, it's just a really special thing. And I'm a very busy person, but I just love it so much. And it just means so much to me. And I want to just keep helping as many women as I can. So
it shows. That's why I got you. So lastly, Rebecca, I'm just curious if you kind of close us out on why you wanted to get into this aspect of psychology, because you have a long laundry list of accolades, but why'd you want to pursue this area?
Yeah. So, similar to you, I was always somewhat interested in it. Being an Army psychologist, working with female service members, physical fitness in the military is very important. And so when, what kind of started getting me interested my first pregnancy, I started seeing a lot of clients come through the Army side that were pregnant and postpartum and unable to pass their physical fitness test. Or if it wasn't just a physical component, it was, now I'm a mom, I have this huge extra responsibility. It's my priority, but I'm still in the Army. And the dichotomy of how to manage that work versus life, family balance. And there was so much distress associated with it, and causes a lot of people to come to me as a clinical psychologist. So that's where I kind of started getting interested in the pregnancy postpartum phase. Well, then at age 38, so advanced maternal age, my husband and I started our family. And then it happened to me. And I'm now in the military, and I'm busy, but now I'm pregnant, and now I'm seeing, this is hard. This is And you don't even have to have a job outside of your home for it to be difficult. To Marissa's point, it changes everything about you. And so I started really getting invested in the postpartum and perinatal mental health component because of my own experience and seeing how it worked in the military. Fortunately, I'm in a position now in the military that focuses on holistic health. So we look at physical, mental readiness, nutrition, spiritual, and sleep domains. I am also the pregnancy and postpartum director for the military's pregnancy and postpartum program.
Accolades.
So throwing that out there. And again, my role in E2M is very separate from the military, but what I love, and Marissa spoke to this, and I'm going to echo it, education. Insight, understanding, getting ahead of what people will experience through this life change in a positive way, where we can provide a lot of the education components and the knowledge-based components and the social support. So when you're in it and you're in the deep of it and you're not doing well, the emotional regulation to understand it, the validation to say it's okay to feel that way, and for us to be there and kind of help you through, giving you a couple of little key pointers that might get you out of it. And then the preventative education piece that we can offer, that's where I'm invested in it. And I, from a professional perspective, but personal perspective, it is a very, very important piece of what we do.
I love it. I'm super thankful and just blessed to have two amazing professionals to serve our postpartum clients. If you guys are interested in doing our program, if you see this podcast, I would love for you to join. The postpartum group is a part of the program when you sign up. It's one of those things where we could do a short podcast and you can see the passion and the drive in these two ladies. But once you become their clients, they'll give you everything they got. So thank you so much, guys, for tuning in. I appreciate it. Ladies, thank you so much. I appreciate y'all, and hope to see you guys in our program soon.